Well, good afternoon. I'm Rick Morin, Dean of the College of Medicine here at the University of Vermont. And it's my great pleasure to welcome you all of you, to the 2016 Dean's Distinguished Lecture in Global Health. Our guest lecturer today is Professor Alexey Sozinov, who is Rector of the Kazan State Medical University in the Republic of Tatarstan in Russia. I also want to extend a warm welcome to our colleagues. There are other colleagues from Kazan and from the Dominican Republic and from Uganda and Vietnam. You're lining up over here? I'm sorry. We need to have them for the translation. I'm sorry.
Go ahead.
Okay. So let me finish my paragraph. Could you?
Yes.
Are you good?
Yes, please.
Are you good?
You can finish your paragraph.
Okay. So I also want to welcome publicly our other colleagues from Kazan and from the Dominican Republic, Uganda, and Vietnam. We're all here today to celebrate World Health Day and to celebrate this joint program between the University of Vermont and the Western Connecticut Health Network.
Здравствуйте, я являюсь деканом данного университета, колледжа медицины Университета Вермонта, и я рад вас приветствовать на лекции почетного профессора в 2016 году. В этом году прочитать лекцию приехал ректор Казанского государственного медицинского университета Алексей Созинов. Я рад приветствовать его, а также других гостей из Казани, Доминиканской республики, Вьетнама, Уганды. И очень рад, что вы проведете с нами Дни глобальной медицины.
Buenas tardes, soy Rick Morin, decano de la Escuela de Medicina de la Universidad de Vermont. Es un placer para mí darles la bienvenida al Seminario para Decanos Distinguidos en Salud Global 2016 y a nuestro invitado especial, Profesor Alexey Sozinov, Rector de la Universidad de Kazan en Rusia. También la más cordial bienvenida a sus colegas de Kazan y nuestros distinguidos invitados y líderes de salud global de la República Dominicana, Uganda y Vietnam, que han venido a celebrar el Día Mundial de la Salud Global y el programa conjunto entre la Universidad de Vermont y el WCHN.
Thank you. Medicine has always been a profession of connections between patients and physicians, nurses and families, teachers and students, and many others. Today, connections across communities, across nations, and across the world are increasingly important. Developing these connections is responsibility of everyone in this room, and you have all clearly gladly taken that on.
Профессия врача всегда была связана с взаимодействием и со связями. Это связи между врачами и пациентами, между медсестрами, средним медицинским персоналом и семьями, между преподавателями и студентами. Но в настоящее время мы должны также развивать связи между городами, между странами и связями во всем мире. И я считаю, что это обязанность каждого из нас, присутствующих в этом зале, развивать эти связи.
La medicina es una profesión de conexiones pacientes y médicos, enfermos y familiares, profesores y estudiantes. Hoy, construir esas conexiones es más importante que nunca, no solo en nuestros hospitales y clínicos, sino también a través de nuestras comunidades, nuestras naciones y alrededores del mundo. Junto con la Universidad de Vermont y nuestros colegas de Connecticut, es una responsabilidad que todos en este salón hemos aceptado conectos.
More than 2,000 years ago, that responsibility for connections was outlined in the Hippocratic Oath, which is one of the oldest binding documents in history. for centuries is called upon us as healthcare providers, physicians, to protect our patients from harm and injustice, and to remember that we remain a member of society with special obligations to all our fellow human beings, those sound of mind and body, as well as the infirm. Today, those commitments remain tenets of our commitment to global health.
Упоминались еще в одном из древнейших и основополагающих документов в клятве Гиппократа, в которых сказано, что врачи и медицинские работники являются непростыми людьми. У нас есть обязательства по отношению к остальным людям, в частности, к тем, у которых есть какие-то недуги души и тела. И сейчас мы все вместе должны использовать постулаты этого документа для развития глобального здоровья.
Más de 2000 años atrás, esta responsabilidad era subrayada en el juramento hipocrático, uno de los más antiguos documentos de la historia. Por siglos, nuestra profesión ha prometido proteger al paciente de daños y injusticias y recordar que somos miembros de la sociedad con obligaciones especiales con los demás seres humanos, aquellos que gozan de salud de la mente y cuerpo, como los enfermos. Hoy, aquellos siguen siendo el motivo de nuestro compromiso con la salud global.
To each of you joining us today, I appreciate your commitment to our efforts in global health, and I look forward to celebrating many milestones with you in the months and years ahead.
Что касается всех присутствующих в этом зале, я хотел бы поблагодарить вас за все то, что вы уже сделали в отношении глобального здоровья, но я с радостью смотрю вперед и надеюсь, что у нас в дальнейшем будет много побед и достижений в области глобального здоровья.
Para cada uno de ustedes que hoy nos acompañados, agradecer su compromiso y apoyo con la educación, investigación y servicio en salud global, y esperamos seguir celebrando con ustedes muchos logros más en los meses y años por venir.
Now it is my great pleasure to introduce Dr. Majid Sadiq, Director of the Global Health Program and the architect of this week's extraordinary gathering. Majid?
Thank you really very much, and I welcome all of you, and those who are coming from Burlington, those who are coming from Danbury or other parts of Connecticut, more distantly those who are coming from Dominican Republic, and I know that some of you, they flew from Uganda, and still you are in jet lag. I would only love to share with you that this program is kind of really new. It was established in 2012. In a matter of fact, in 2012, we were very much engaged with only putting together the elements and infrastructure of global health. Thanks to the energy and love and interest in global health among many of the faculty of University of Vermont College of Medicine and beyond, particularly the leadership at Western Connecticut HealthNet, the program grew very substantially over the last 3 years. The first year, probably, we deployed only 3 or 4 people to different parts of the world. I want to let you know that in 2016, we have more than 5 sites in Uganda. We have 1 site in Russia, and we have 1 site in Zimbabwe, and 3 sites in Dominican Republic, and 1 site in Vietnam. And we are planning to send 100 students, residents, faculty to these 5 sites in 2016. The budget, which was very much limited now, is close to $1 million annually. So we grew substantially, and I want to give all of the credits to the people that you see on the photos on the slide, from the leadership, from Dean Morin that we are very much really thank to him and his visionary work of the global health, to Bill Jeffrey, to Tanya Birch, who are really leader in medical education in this part, to Molly, to Michelle and Mariah, my friends in Western Connecticut, in University of Vermont, to so many of the other people, including new leadership in Western Connecticut Health, run by two phenomenal people. Obviously, it is Jonathan Fine, Steve Winter, Patricia Wetherill, and then also my colleagues and my friend in Office of Global Health. Particularly credit goes to Lori, who is really phenomenal person that managed my financial scope of really global health, and also Emma, Leah, Swapnil, and there are so many other people. Thanks to go to all of them. But the major question that really this afternoon I would like really to address is why we are all in love with global health. What is in global health that is transforming the people from selfishness to being ready and willing to give? I had really a few members in my department, including Leah, Emma, and a few that we sat down with Swapnil, and we thought really how I can really paraphrase the philosophy of global health to let me digest why we are in love in global health. And this is basically we came to sort of really consensus. The practice of global health connects us to the people of diverse perspectives and colors, an open reflection to ourselves and the lived experience. We learn to respect differences and recognize shared humanness. We cultivate pure human connection rooted in empathy, unhindered by the superficial separation created by classism, racism, colonialism, structural oppression. We are invigorated, energized by the fortune of understanding others through their histories, strengths, weaknesses, fears, and failures. We learn about ourselves by reciprocating that vulnerability, by being exposed openly. In that openness, we discover weaknesses, impurities, prejudices, deficiencies in our own substance. We are then driven to improve our humanness, to become more caring, more compassionate, more aware, and more giving. Tragedy and suffering born from human rights inequalities, particularly health inequalities, social injustice, and poverty, are illuminated on a grand stage under a beam of light. All that is usually hidden is revealed. We stand united on the stage to advocate for those who have been enshrouded behind the curtain. Their tragedies teach us something about resilience, and we find hope in their strength. Their stories tremble through the comfortable encasement of our privilege until it cracks and shatters down, and we learn to care about something outside of ourselves. In discovering the roots of empathy, we rediscover what called us toward the field of medicine. In this essence, the profession is calling all the service, and at the service of the underserved, we follow the calling. And this afternoon, we are gathered here to celebrate around the philosophy of the global health and to celebrate our accomplishment in the last really 3 or 4 years. And I hope our friends coming from all over the world, they will find a platform to shake hands, to find a new initiatives that we can creatively bring something new to the medical education, to the peace of the globe, because if there is only one hope that the human has to be connected and to survive on this surface of the earth, is through the language of health. Because when we are sick is when that we are vulnerable and we are ready to speak to each other and we are ready to negotiate and we are ready to become united, because all of us, we are united in suffering. Thank you really very much. At this point of time, I'm going to request only Dr. Moore to take the podium, and Dr. Moore is going to introduce Professor Sozinov, the rector of the Kazan State Medical University.
Hi, I'm Molly Moore. I'm one of the pediatricians here at UVM, and it is my distinct honor to introduce Professor Alexey Sozinov, Rector of Kazan State Medical University in Russia. He has a distinguished career as a physician, scientist,
Tatarstan, we can.
an innovator, and an active public servant. He graduated with honors from Kazan State Medical Institute in 1987, went on to complete a residency in infectious diseases, and then to earn a doctorate in infectious disease. He was later awarded the prestigious Doctor of Science degree. He joined the faculty at the Department of Infectious Disease at Kazan State Medical Institute in 1992. In 1996, he became Vice Rector of Educational Affairs for Kazan State Medical University, and subsequently was named Rector of the same institute in 2008. In 2013, he was appointed as the corresponding member of the Academy of Sciences of the Republic of Tatarstan, and in 2014, he was elected as a deputy, which is a member of parliament, to the Republic of Tatarstan. In addition to his significant work in infectious disease, in 2003, he also became head of the Department of Biomedical Ethics and Medical Legislation. He is the chief editor of the Kazan Medical Journal and serves in multiple other editorial boards. He is also the vice president of the Council of Rectors of the Republic of Tatarstan and a member of the Coordination Council of the Federal Service of the Supervision of Consumer Protection and Welfare of the Republic of Tatarstan for Public Health Monitoring. We are honored to have Rector Sozinov and his colleagues from Kazan State Medical University join us today, along with our other distinguished guests. Thank you and welcome.
Ladies and gentlemen, thank you so much. First of all, I'd like to present you a short film about our motherland, Republic of Tatarstan.
Tatarstan, we can. Tatarstan, gateway to the world, at the heart of the world, where East meets West. Tatarstan, the heartbeat of Russia. Tatarstan is one of the most historic and dynamic regions in all of Russia. Peaceful, stable. Tatarstan is home to over 100 nationalities that are proudly united by one phrase.
Без Bulgaravs. This means we can. The optimism of Tatarstan. Constant forward motion.
Tatarstan, land of harmony. Harmony and coexistence are the soul of Tatarstan's rich 1,000-year history.
We can!
Tatarstan, land of prosperity. The capital of Tatarstan is Kazan, just an hour's flight from Moscow. Kazan is famed as Russia's third city. Ernst & Young declares Kazan the best city for doing business in all of Russia.
Tatarstan, moving at the speed of light.
Kazan's groundbreaking IT park has some calling Kazan the Singapore of Russia.
The IT park is the largest techno park in Eastern Europe and Russia.
Tatarstan boasts an abundance of natural resources, including an oil forecast of over 1 billion tons. Tatarstan's oil refining sector continues to grow, attracting energy investments from around the globe, led by Tatneft, one of the largest oil and gas companies in Russia.
We can!
In addition to the energy sector, leading companies in aviation, organic chemistry, agriculture, and automotive flourish here in Tatarstan. Kamaz is the largest automotive maker in Russia. Their Master Dakar team has won the Paris Dakar Rally a record 10 times.
We can!
The best brands of the world recognize Tatarstan. Mercedes recently launched a new plant in Neberezhny Chelny.
Mercedes could have opened a factory anywhere in Russia. We chose Tatarstan.
Tatarstan's business-friendly government will help you succeed.
Tatarstan is led by a dynamic, ultra-modern government.
We can!
Tatarstan's economic prosperity is only matched by its success and passion for sport. Tatarstan, land of excellence. Kazan is officially known as the sports capital of Russia. We are a city of champions. Come cheer for Rubin Kazan, two-time Russian Premier League champions.
We can!
Kazan is also home to the championship-winning Akbars hockey team, as well as the Sintez water polo team, Unix basketball, and Dynamo volleyball. In addition to team sports, you can thrill to world-class horse racing at the largest equestrian center in Russia. Racing comes to Kazan with a Formula One H2O Grand Prix and the WTCC in 2012. Would you like to play where the Russian Golf Cup takes place every summer? Or make your way down the mountain at Sviaga, one of the largest ski resorts in the region? Kazan becomes part of sports history as we host the 2013 University Games, the second largest sporting event in the world.
We can!
In 2015, Kazan will host the FINA World Aquatics Championships. And Kazan is proud to be one of the prestigious host cities of the 2018 FIFA World Cup.
Tatarstan, land of culture.
Tatarstan is the home to many world religions living in peace.
Christianity and Islam have lived here in harmony for over 1,000 years. We can!
In Kazan, we celebrate this diversity at the Temple of All Religions, a shining symbol of religious tolerance.
We can!
Tatarstan's love of the arts goes back 1,000 years. We are a destination of world-class performances in music, theater, opera, and dance. Enjoy the spectacular Kazan Opera and Ballet Theater, one of the most visited concert halls in all of Russia. Here, the genius of native Tatar Rudolf Nureyev can still be felt.
We can!
For movie lovers, there is the Kazan International Festival of Muslim Cinema, known worldwide for its annual themes of peace. Tatarstan festivals such as Sabantui, Shalyapin, Caravan, and Republic Day have always been an important part of Tatarstan culture.
Rich in history, headed towards the future.
Higher education is a point of pride in Kazan. In Kazan, there are more than 210,000 students from around the world attending over 40 universities, academies, and institutions. This is why we are also known as the City of Learning. We are proud of our bright young minds that build Kazan's educated workforce. Kazan boasts some of the best hospitals in Russia, an ultra-modern metro system, and is completing a brand new international airport.
Kazan's quality of life is rated one of the highest of all Russian cities, with the very best standards of living.
Let us dazzle your palate with our fine dining, or relax at one of our 4- and 5-star hotels. And finally, we invite you to indulge in the city's luxury shopping.
We can!
In the heartbeat of the world, where East meets West, prosperity, excellence, and culture create the heartbeat of Tatarstan. Unique in so many ways, with so much to offer. Rich in history, headed towards the future, the heartbeat of Russia.
Tatarstan, gateway to the world. Welcome to Tatarstan!
to Kazan!
Welcome to Tatarstan!
Tatarstan. We can.
Dear colleagues, before I start, I ask you, excuse my English, it isn't so perfect, and so I will use notes. Ladies and gentlemen, dear colleagues, Dr. Morin, first of all, let me thank the Dean, Professor Morin, for the invitation to take part in these days of global health, and the organizers for the opportunity to speak with an honorary lecture, a respectable audience for interest you have shown to our message, and of course, Professor Sadiq, because he's the one who told you about a city in the world named Kazan and about a medical university within it. We are doing our best to become an international university. However, it turned out that the history predetermined such a path for our medical school. Medical school appeared in Kazan as the faculty of Imperial University at the behest of one of the most enlightened Russian emperors, Alexander I, in 1804. It was the second classic university after Moscow on the territory of modern Russia. And until 1888, it has been the easternmost university of European type. For long years, Kazan provided higher education and managed all education system, including high schools, from the White Sea in the north to the Caspian Sea in the south, borders of Iran, from the Volga River in the west to the Pacific Ocean in the east, namely until the US marine borders. Currently, two of oldest universities of Russian Empire are located outside of modern Russian Federation, Tartu University in Estonia and Kharkiv University in Ukraine. The entire system of higher education of Russian Empire significantly influenced 17 countries that were a part of Russian Empire, such as Finland, Poland, Ukraine, Belarus, Kazakhstan, etc., including 6 within the former Kazan Educational District. The history of Kazan Medical School has international origin. The first members of Academic Council of Medical School of Kazan University were foreigners, 5 German, Rector Braun, Dean Erdmann, Dr. Arnhold, Dr. Reinhardt, Dr. Fuchs, and 1 Italian, Dr. Valderrama. Lectures for 30 years were read in Latin, German, and French. First meeting of Academic Council held on May 14, 1814 is considered now as KSMU foundation date. Professors of KSMU proved themselves as gifted administrators of medical education at international level. Professor Vasily Razumovsky, professor of surgery of Kazan Medical School, founded Tbilisi Institution in 1913 in Georgia and Baku Medical University in 1919 in Azerbaijan. Dr. Isaac Oxman, professor, head of dentistry department of Kazan Medical School, founded Karaganda Medical University in 1915 in Kazakhstan. The model of Russian medical education is unique. It is based on combination of German, French, and English models. Russian model accumulated the following features of those models. Forschung und Lehre in German principle, which means the learning by research, freedom in education, and clinical education from German model. Division on faculties, the role of university at an operative office of regional education system, obligatory annual exams for French model, and raising student firstly as citizen and gentleman from English model. It should be said that none of them was fully implemented in Russia. 2 centuries have passed. The world medical education system is changing. Why is it so? It happens because the diagnosis and treatment technologies are changing radically, and because doctors are working in very different conditions comparing to ones 20, 30 years ago. Does it look similar? Education as the knowledge of lifetime cannot be used anymore. It has to change due to objective reasons. It is not only that medical equipment has changed. The law, society are changing as well. People have a higher level of requirements, so we need to learn all lifelong. The new education model is appearing. It requires an understanding of the global world. In my opinion, problem-based learning is the most important. PBL is based on the principles of active participation of the student. It is not teaching, it is learning. The essence of problem-based learning can be expressed by the Chinese proverb as interpreted, tell me, I will forget, show me, I may remember, involve me and I will understand, step back and I will act. It's true. High medical education in Russia is realized by medical schools of Ministry of Health, by medical faculties of University of Ministry of Education and Science, and by some private universities. It is important to mention that the greatest value in medical education in Russia is provided by Medical School of Ministry of Health of Russian Federation, like a Kazan Medical University. Because these schools train about 90% of all medical students. About 35,000 of medical students graduate every year in Russia. Since the first year in the medical school, Russian students study at one of the selected specialties, such as general medicine, pediatrics, preventive medicine, dental medicine, pharmacy, nursing, medical biochemistry, medical biophysics, medical cybernetics. We have all medical specialties in KSMU except medical cybernetics. The postgraduate medical education system in Russia is now changing. Current model, upper part of slide, involves two variants of postgraduate specialization. 1 year internship, rest abroad specialization in therapy, surgery, and so on, or 2 years residency, more narrow specialization, for example, neurosurgery, cardiology, and so on. Every 5 years, specialists should undergo once training of 144 hours duration to prolong certification. Future model, in lower part of slide, which will be implemented from this year, suggests continuing professional development. Within medical school, students will earn the qualification of general practitioner, but in order to work at other specialties, they should pass residency, duration residency from 2 to 5 years. To be accredited, specialists have to continuously collect credits, 250 credits per 5 years, 50 credits per every year. The order of transition to the new system of continuous education and accreditation is already defined. Internationally accepted principle of an independent examination is used for the first time. The Accreditation Commission will be composed of representatives of employers, professional associations, and other medical school professors and quality parts. The transition will be long-term, gradual, and will end in 2026. Russia is a huge country. Therefore, all medical universities are divided into 11 regional clusters. The purpose of their creation is to ensure control over the quality of training of the specialists with the help of the most powerful institutions. Kazan Medical University became the coordinator of the research and educational medical cluster in the Middle Volga River. This cluster consists of 5 medical schools in Kazan, Kirov, Ijevsk, Nizhny Novgorod, and Perm, between Volga and Ural Mountains. About 1 week ago, Ministry of Health of Russian Federation approved the program of development for our cluster. We see the mission of Kazan State Medical University in provision of high quality of education, scientific clinical activity corresponding to level of the best medical schools, based on implementation of innovative technologies and realization of effective model of social partnership between KSMU, community, and public health care system. For 2 centuries, KSMU has made significant contribution to the world of medicine and science, being now one of the most prestigious universities in Russia. According to expert rating agency ranking, KSMU holds 31st place among over than 1,000 Russian universities and 4th place among all Russian medical schools last year. According to demand rating by Social Navigator, we are holding the 2nd place among all Russian medical schools. According to academic European ranking, KSMU takes 33rd place among all Russian universities and 3rd place among all Russian medical schools. All Russian medical schools, it's common, 90 medical schools. High ranking of KSMU is confirmed by achievements of our students. Last year, our medical students have won several prestigious all-Russian and international contests on medical practical training. The most valuable award among them is the first degree award at Gold Med Skill All-Russian Olympiad on practical training on medical students in Moscow. Among the 52 teams representing the states of the former Soviet Union, China, and Bulgaria. Our team received the prize from the hands of Ministry of Health of Russian Federation, Veronika Skvortsova. Every year, about 9,000 people study in our university. Today, KSMU is a home of more than 4,500 students, about 1,000 interns, residents, Ph.D. students, and 3,500 trainees every year. Almost 2,000 staff members work at KSMU at full or part-time positions. Our university consists of 64 departments and 8 faculties: general medicine, pediatrics, preventive medicine, dental medicine, pharmacy, social work, higher nursing education, and biomedicine. Training of future medical doctors and scientists is conducted within the residency program in 41 clinical specialties and PhD studentship programs in 40 scientific specialties. The role of our university at the international market of higher education is increasing. Almost every 5th student is a foreigner. Faculty and students have the opportunity of academic mobility. 10-15 KSMU faculty members every year go abroad for international research fellowships in USA, France, Germany, and so on. More than 80 KSMU students are involved in international student exchange programs every year. Germany, Italy, Uganda, Spain, Hungary, and so on. We have more than 30 foreign partner organizations, medical schools, and scientific institutes worldwide. 5-10 eminent faculty members from Europe and America become invited lecturers of KSMU every year. One of the most important indicators of increasing international impact of KSMU is growth of admission of foreign students to medical school. You can see the graph of the impressive dynamics of the share of foreigners in the student population. 10 times increase in 20 years, 3 times in 10 years, 2 times in 5 years. Even more important is that we are making efforts not only to increase the amount of international students, but also to select the best students from abroad. Being an active player on international education market, we are fighting not only for the best students, but also for the best faculty. On this slide, we present internationally recognized faculty from US, UK, France, Finland, who made significant contribution to basic and clinical medical science and worked as invited professors of KSMU during last few years. Most of them are sponsored by grant program of Tatarstan Republic, Algarish, meaning of this Tatar word, Algarish, can be translated to English as progress. International experience is widely used in KSMU for implementation of modern simulation technologies. We have the first established center of practical skills, equipped with simulators, mannequins, and imitators, which are used to ensure qualitative mastering of medical therapeutic and diagnostic manipulations in Russia. The standardized patient technique is used to teach senior year students in collaboration with the experts from US medical schools. KSMU has agreement of network education with one of the best SIM center in Russia, Education Center of High Medical Technologies, Kazan. KSMU is an absolute leader in activity of international students exchanges in Russia. Since 1995, Tatarstan Medical Students Association is an active member of International Federation of Medical Students Associations. More than 500 students of our university have participated in medical practice abroad. More than 200 foreign medical students have medical clerkship in Kazan during the last 10 years. Our Medical Students Association also develops other public projects for medical students such as Academy of Health, Be Pharma Free, House MD, Key to Success, and Marrow. Geography of IFMSA exchanges in Kazan includes more than 40 countries worldwide. KSMU has long-lasting partnership relations with more than 30 foreign medical schools and scientific institutes from US, France, Canada, Germany, Italy, Finland, Norway, and many others. We are open to new collaboration projects. I can honestly say that the most rewarding and long-lasting international experience of our university arises from collaboration with medical schools of United States, particularly developed through our fruitful interaction with Professor Majid Sadiq. The first collaboration was started in 1996 with an USAID project involving University of Rochester and Yale School of Medicine from United States. The list of our US partner medical institutions for last 20 years includes University of Vermont College of Medicine, Yale School of Medicine, Medical Center of University of Rochester, Virginia Tech Carolina School of Medicine, Nova Southeastern University College of Medicine, West Carolina University, and University of Nebraska Medical School. The main direction of collaboration include clinical clerkship in the best US medical schools and hospitals, seminars and lectures of invited professors and KSMU, joint research projects, and development of simulation technologies. Collaboration of our university with Yale School of Medicine was established in 1997 after bilateral visit of KSMU and Yale faculty and leaders to US and Russia. This collaboration was possible primarily due to the effort of Dr. Neil Amirov, who was rector of KSMU at that time, and Dr. Sadiq, Associate Director of Yale Primary Care Residency Program, US Site Coordinator of Exchange on that time. More than 40 faculty members and residents had clinical training in Yale hospitals. More than 20 Yale faculties visited Kazan and our campus in Nabережные Челны for delivering lectures and clinical experience exchange. 10 US residents worked in KSMU hospitals with Russian colleagues. One of important steps at the beginning of collaboration was a donation of English language library from Yale faculty to our university in 1999. Yale KSMU academic exchange program significantly promoted their professional growth and KSMU development in general. Faculty members and residents who pass clinical and scientific fellowships in Yale School of Medicine are now working at senior positions as prominent clinicians and scientists at our university. Sergei Baychuk is a Dean of Biomedical Faculty. Diana Abdulganieva is a head of Department of Internal Medicine. Gulshat Hasanova is head of Department of Epidemiology. Adela Maksudova is Professor of Internal Medicine, Director of Pilot Residency Program of Internal Medicine. Alexander Samuilov is the head of Ophthalmology Department. Other alumni of KSMU Yale Exchange Program work as professors and principal investigators at KSMU, Kazan Federal University, Kazan Medical Academy, and the best clinics of Tatarstan. Due to the experience gained in New Haven and Otterbury, graduates of the internship at Yale Medical School hospitals introduced the principles of work teams, Stanford model of evaluation of teachers and students, and methods of biostatistics and evidence-based medicine into the Russian practice. Some KSMU graduates, after participation in Yale KSMU exchange program, have gone abroad and now work as medical doctors or scientists in US and UK. Since 2010, we are actively developing our collaboration with University of Vermont College of Medicine and Western Connecticut Health Network. This cooperation is progressing within Global Health Program, as well as Yale KSMU Exchange. This international project of KSMU is based on our long-term cooperation with Professor Majid Sadiq. Within Global Health elective interns, residents, senior medical students from both sides pass 6-week clerkship in partner institution, which includes clinical work, field trips, education, and research activities. The exchange program for junior students includes research activity and in basic and clinical science. Curriculum for students from Vermont University and Danbury hospitals that comes from Global Health Selective to Kazan includes clinical rotation in internal medicine, cardiology, infectious diseases, gastroenterology, nephrology, neurology, research projects on neuroscience, physiology, cell biology, pathology, and cardiology. Supplementary curriculum includes lectures on history of Russia and Tatarstan, socio-political issues, Russian and Tatar language, city tours, museum visits, theater, ballet, trips to Moscow, St. Petersburg, and ancient Bulgar. Day before departing to United States, I met 2 senior students who come to KSMU from Ross University within Global Health Program for 6-week elective. Since 2010, within Global Health Program, KSMU successfully developed joint Global Health Selective with University Vermont, Yale University, and Makerere University, Uganda. Within Uganda elective, 20 KSMU representatives had completed 6-week Global Health Selective in Mulaga Hospital at the University of Makerere, which gave them an invaluable clinical experience. Trip to Africa isn't only clinical, but also an important cultural experience that changes the value of life for each participant of this program. We have not established effective direct contacts with the University of Makerere so far. I think it's a matter of time. It's very simple. We need to find and raise our own Dr. Sadiq in Mulaga Hospital or in Kazan. But no one ever managed to clone Dr. Sadiq. So he sets records in performance by himself. Since 1997, he held more than 20 seminars on infectious and tropical diseases, biostatistics, and evidence-based medicine in Kazan and in the second largest city of Tatarstan named Nabережные Челны. More than 1,200 doctors of different specialties became his audience over the years. If I was the head of any religious sect, I would definitely attract Professor Sadiq as a missionary. With his capacity for work and the ability to communicate with people, you can achieve a world religion within 20, 30 years. Of course, it was a joke, but I must say that I don't know anyone who would say, he is a bad man. After talking to the Professor Majid, it is a fact. The impact of our friends, invited professors from US medical schools on our university is highly appreciated by students, faculty, and leaders of KSMU. Dr. Michael DeBakey from Baylor College of Medicine, Dr. Majid Sadiq from University of Vermont College of Medicine, Dr. Asghar Rastigar from Yale School of Medicine, Dr. Jeffrey Wong from Pennsylvania State College of Medicine, Dr. Hedy Lane from Virginia Tech Carilion School of Medicine were awarded to the title of Honored Professor of KSMU, which is the highest recognition of impact on development of our university. There are 5 American among the 25 people from around the world awarded with the title of Honorary Professor in our university since 1996. Now you are a recognized part of the history of our university. We will also write our future history together. The new exciting direction in KSMU international collaboration is development on competency-based medical education in collaboration with Royal College Canada International. The pilot residency program in internal medicine, of course, started in November 2015. Now we have a real international team of residents in this program, which consists of citizens of US, Pakistan, and India. Collaboration agreement with Royal College Canada International was signed on January this year in Kazan. First site visit of Royal College of Canada to KSMU is scheduled on May 2016. After this visit, we will receive the roadmap, which will show the perspectives of accreditation of KSMU residency program by Royal College International. The present and the future of international cooperation in KSMU is the subject of attention of the supreme governing body of university, the Academic Council. Not less than once a year, we review the issue on its meeting. Contact with foreign organizations and a search for cooperation with foreign partners, students from abroad, and organization of academic mobility, both for students and the faculty of KSMU, is priority for me as a rector. Each direction of the work is being implemented under the guidance of Vice Rector and a relevant department. Speaking about the ones who are here, Marat Muhammedyarov is the head of International Office, and Arina Ziganshina until recently has been the head of Tatarstan branch of the IFMSA. In 2016, we launched International Scientific Board of KSMU. This council was established for consulting in scientific education, innovative and clinical activity of KSMU, for evaluation of perspective projects for our university, accumulation of the best international experience for achievement of strategic goals of university. Currently, it consists of 12 members, good friends of KSMU, eminent scientists, doctors, leaders of medical education, recognized at international level. 4 of them are from USA. First meeting of board is scheduled on May 17 this year. These are the days in which we celebrate the annual University Day, called an Assembly Day. In the picture, you can see the celebration of the 200th anniversary of the university in 2014. We are proud that we were congratulated by the President of the Republic Tatarstan, by the Ministry of Health of the Russian Federation, by the rectors of all medical universities in Russia, and even by the Indian ambassador. KSMU staff was awarded by gratitude of President of Russian Federation, Vladimir Vladimirovich Putin. I want to finish my Dean lecture with the words of the 16th President of USA, Abraham Lincoln. If I had 8 hours to chop a tree, I would spend 6 hours sharpening my axe. The axe will never be our weapon, as we are peaceful people who bring kindness and mercy to the world. I am sure that this statement perfectly describes how medical schools must refer to the quality and methodology of medical education, and we must do it together. International experience and collaboration evidently is the best greenstone to establish high-quality medical education. Thank you for your attention. I will be happy to answer your questions. Thank you so much. I ask my colleague and my daughter, Arina, to help me for interpreting.
It's certainly impressive, the amazing international collaborations you've had over a very long period of time and a very large number of faculty and students. I had some questions about some of the numbers you gave, just to get an idea of the physician sort of workforce in Russia. I think you said that there were 35,000 graduates of medical schools in Russia a year. Is that about right?
35,000.
Okay, and
from all Russian medical
right.
schools,
And
90% of them from the medical schools of Ministry of Health,
right.
Russian Federation.
And there are about 180 million people, 190 million people in Russia?
All population of Russian Federation is about 145 millions.
Okay, so in the U.S. we have 330 million people, so it's a little more than twice as large population, but our medical graduates all added together is about 25 or 6,000. So you're graduating, a third more students for half the. So it's sort of the question is the supply of the physician-patient ratio, the population per you must have twice as many physicians, at least twice as many, maybe 3 times as many.
Relation between doctors and population in Russian Federation is the best in the world. 1 doctor on 230 people.
that's way, that's double
In
and triple,
United
but
States, about 1 doctor per 350
I don't think
people,
it's that good.
maybe. Okay.
But in most states, it'll be 1 in 600, you know, 1 in 1,000. So it's a much higher penetration of physicians. Well, see, when I speak to the legislature here or the citizens here, and they always complain about how we don't have enough doctors, and particularly enough primary care doctors, and I always say, but we're first amongst all 50 states in the United States for physicians per capita. We're first in primary care physicians. But now I understand, they want your numbers, not our numbers.
Any more questions?
Okay.
Now, you're changing your residency accrediting process, and what are some of the drivers that created the need to change the process?
У нас меняется система постдипломного образования. Какие были причины для того, чтобы ее изменить?
Главная причина – обеспечить повышение качества работы врачей и организовать постоянное повышение квалификации, потому что сейчас врач проходит постдипломное обучение 1 раз в 5 лет продолжительностью 144 часа. Мы хотим добиться, чтобы врач занимался образовательными активностями постоянно, так как это происходит и в США, и в европейских странах, набирая кредиты, что приведет к повышению качества его работы.
The reason is we want to ensure that we have quality, that we have the doctors with a good quality of training. So currently, they after they graduate, they have to study only once in 5 years. They have to undergo a cycle of 144 hours to get a certificate to work as a doctor again. And we want to ensure we have a continuous learning, so the doctors in the postgraduate, they should learn all the time, getting the credits, so they will be educated, up to date. That's what we want. So they will provide the better quality of care.
And one additional moment. Сейчас субъектом права в России в медицине является медицинская организация. Когда случаются нежелательные явления в медицине, гражданин обращается в суд, отвечает медицинская организация. Новая система приведет к персональной аккредитации врача и сделает его субъектом права.
It's also the matter of law, because now the medical organization, like the hospital or clinic, is responsible for everything. So if the doctor makes
Not medical doctor, medical organization.
Medical organization, but not medical doctor. So if the doctor makes any mistake or whatever, the clinic is responsible for that. But after these reform, after those changes, the doctor will be accredited. Not only the hospital, but the doctor itself. So the doctor will be responsible for its own faults and mistakes.
One follow-up question, and that is that if I understood it right, are all of the specialists coming from the generalists? Like every graduate becomes a general practitioner, and then from those, the specialists are chosen? Is that how it works?
То есть, так как я понял, после выпуска каждый выпускник становится врачом общей практики, и только после этого они выбирают какие-то специальности.
Сейчас это не так. Сейчас можно выбрать или общую практику, или специальность, и параллельно можно получить ее через интернатуру, ординатуру. Новая система вносит ясность. Практически все будут работать врачами общей практики, и потом при желании становиться, значит, специалистами. И только небольшая часть будет получать сразу право идти в резидентуру.
So the system which we have now, it doesn't require you to be a general practitioner. Once you graduate, you are to decide the specialty you want to proceed. You can go either to internship or to residency. But the new system will change it a little bit because most of the people will become general practitioners, and only if you will get a chance to go to the residency straightforward. As far as the majority is concerned, they will be allowed to choose a narrow specialty only after they work as general practitioners for several years. Okay.
Do students pay to go to school, or is the education provided by the state?
Okay. Платят ли у нас студенты за обучение или государство оплачивает обучение?
Часть студентов обучаются за счет федерального бюджета, часть студентов поступают за счет средств своих родителей.
So some of the students are paid by the state budget, while some of the students have to pay for the education themselves. Having fitness.
I assume the education there is in Russian, right? How do international students learn the language as part of their education in medical school, or they go to a program before they start medical school in Kazan?
То есть, как я понимаю, у вас образовательная деятельность осуществляется на русском языке. Как быть иностранным студентом? Есть ли для них какая-то подготовка?
Отвечайте, Арина, вы знаете, что есть и что на английском языке, и на русском.
Okay, so
we teach in Russian language for Russian citizens and in English for foreign citizens.
We have special groups of foreigners.
And our faculty speak English. I am one people who cannot speak English, so I am rector. Часть иностранных студентов учатся на русском языке, в основном это граждане республик бывшего Советского Союза.
Students, foreign students, they study in Russian groups, and most of them are the citizens of the states of former Soviet Union, so they know Russian. Sorry.
This is again about the numbers. It's interesting to see how, it's really impressive the number of the physicians you produce. There was also another number that really surprised you. I thought I heard on the in the video, there were 210,000 students in colleges and university in Kazan. Isn't that what the video said?
Сколько у нас всего студентов во всех университетах в Казани? Там в видео была цифра.
Этот фильм был сделан 2 года тому назад. Сейчас студентов немного меньше, 160 тысяч. В Казани 1 миллион 100 тысяч населения, 160 тысяч из них студенты.
That's still a huge ratio. I mean, I don't know, that would be like us having 80,000 students in Vermont or 90,000 students in the state of Vermont. Education is really, it's great that education is so important in the Russian Republic.
Kazan is students' city.
We just don't want to work,
city
we
for
want to
students.
study.
Arin.
Oh, sorry. I'll go back to you.
Looking at the presentation, so all your specialties are medical specialties. I didn't see any surgical specialties. Where do they train your surgeons?
в постдипломном образовании после медицинского и педиатрического факультета можно стать хирургом. Сейчас это ординатура 2 года.
Once you graduate from the faculty of general medicine or the pediatrics, you can undergo the residency in surgery and you'll become a surgeon.
I'm just wondering about the ratio of men to women medical school graduates.
80% of our students are women. 80%. 80%. Medicine is female specialty. Female. Our man works in oil industry.
Thank you so much for interesting presentation. And how I can ask about the school fee of the foreigner student. They involved in medical school in Kazan, please.
$5,000 per year. It's good question. You ask, I have to say that we have different prices for citizens of former Soviet Union, for India, and for European countries, for US. $4,500 is in the middle, and maybe from $3,500 to $10,000 from citizens of different countries. Yeah. $4,500.
So you can come here for $5,000 a year too. You can only, but you only take one course a year.
So how does one determine who gets money paid by the government versus not?
Competition, конкурс, кто набрал больше баллов, тот получает федеральный бюджет.
So it's the competition. Once we graduate from high school, we have to pass the exam, and ones who have better scores, they get the better spots, governmentally paid spots. Yes, kind of.
Правда, надо сказать, что есть семьи, которые не хотят участвовать в конкурсе и испытывать волнение, они сразу платят и учатся за свой счет.
Some families are too stressed with all those competitions, so they prefer just to pay straight away and to go to the private bases. Mm-hmm.
Other people stressed when pay.
We have a problem in this country attracting young trainees into primary care practices. Some countries manage that by controlling the access to subspecialty training. Do you control access to subspecialty training? Do you have problems having enough primary care physicians?
То есть вопрос о первичном звене. То есть они пытаются контролировать число мест для постдипломного образования в первичном звене и в узких специальностях. Какова ситуация у нас? Достаточно ли у нас врачей именно первичного звена и одинаковый ли у нас доступ к первичному звену и к узким специальностям?
В России существуют диспропорции. Есть специальности, где специалистов больше обеспеченность, очень хорошие. Есть специальности, где есть некоторый дефицит. Скажем, дефицитными являются такие специалисты, как инфекционные болезни, фтизиатрия, анестезиология. Ну, в целом, это очень такая мозаичная картина, то есть по разным специальностям разная обеспеченность. Все зависит от уровня заработной платы и условий труда.
We do have a disproportion in different specialties. For example, we lack specialists in infectious diseases, TB in anesthesiology, but this picture changes from year to year, and it depends on the level of salary, working conditions, and things like that.
8% медицинских работников каждый год уходят из отрасли, это официальные данные, потому что в отличие от США врачи имеют невысокую заработную плату в России.
Unfortunately, we have a statistics that each year 8% of the doctors leave the profession because comparing to the US, we have very small salaries for doctors.
Президент Путин издал указ о том, что к 2020 году врачи получали двойную зарплату по отношению к среднему по региону.
The Putin came up with the law that by the year 2020, the doctors should get a salary which is twice bigger than the average salary in the region.
Потому что в Россия не только большая, но очень разная. Есть регионы, где средняя заработная плата 25 тысяч рублей, а есть регионы даже 20 тысяч рублей, а есть регионы, где средняя заработная плата 80 тысяч рублей.
Only big, it is also very different because in some regions the average salary can be 20,000 rubles, while in some it can be 80,000 rubles.
Per month.
In Vietnam, for many years ago, we also have the system of the specialists after the graduations from the medical school. And we have two systems. One system is specialist one, and after that specialist two, like your question. And another system, master degree and Ph.D. degree. It's different. So that I want to ask about your system, specialist system, and have a master degree and PhD degree is different or is the same system? Thank you.
Да. Нет, ну все-таки это поясню.
Развитие по клинической отрасли и по научной. То есть по клинической ты заканчиваешь интернатуру, затем можешь пройти ординатуру, а вот именно по научной стезе они похожи или отличаются?
Человек может выбрать научный путь, не получать после окончания вуза аккредитацию или сертификацию и идти сразу в аспирантуру и делать науку, как сделал Марат Мухамедьяров. А можно делать параллельно, то есть работать клиническим врачом и сделать работу Ph.D. и докторскую работу. И так возможно.
There are two possible ways. Once you graduate from the medical school, you do not necessarily go through the accreditation process. You can choose science and you can do basic science, and you can go to postgraduate like our friend Marat. But at the same time, you can undergo through the clinical internship or residency, and then you can enter the course of postgraduate, and you can become a Ph.D., for example, in internal medicine or in any clinical, clinical science.
As Arina, she is a medical doctor and she make PhD.
Those are different. Our two system is different. But you can combine it. Yeah, now it's not combined. But you can be a science and a doctor at the same time, a medical doctor and a scientist at the same time.
У нас одноуровневая система, мы не готовим бакалавров, и у нас нет степени бакалавра-мастера, у нас есть степень специалист, называется.
Master's degree would just provide specialists.
Do you have plans to create a computerized system for medical records, electronic medical record system?
In a hospital or where?
Both.
Есть у нас и планируется создание электронной системы ведения медицинских записей.
И планируется, работа это ведется. Сейчас, скажем, в республике сделан единый банк всех медицинских визуализаций. Идет программа создания компьютерных рабочих мест. Врачи обеспечиваются компьютерами и переход на так называемую безбумажную медицину.
System is currently being in progress. Some things have already started. So, for example, we have already have a database in Tatarstan for the different medical results of medical visualization, and the computerization is also going on. So there should be a computer per each doctor, and we are moving to the system where there will be only computers but no papers.
Thank you.
It's tough sometimes.
We see that it's a very difficult process.
Especially for elderly doctors.
What profession do most males go into, since it's so skewed in favor of females for the medical profession?
Я прежде всего сказал, что вот сейчас студентов 80% женщин, но среди врачей пока еще это где-то, наверное, процентов 60, то есть мужчин больше. Когда я учился, у нас было 60% мужчин и 40% женщин. Это процессы, которые произошли в последнее время в связи с бурным развитием предпринимательства. Мужчины выбирают промышленность, мужчины выбирают бизнес.
This ratio changed a little bit because when Professor Sozinov was a student, the majority was male students. 60% of male students and 40% of female students. But now it changed a little bit because of the development of industry and development of business. So men prefer industry and business.
No. Next questions? Thank you. Thank you for your attention. Thank you for perfect questions.